When it comes to Medicare coverage and understanding the ins and outs of what you need to know, it's not easy, and it can feel like you need a lesson just to get an education on what are the right choices for you or choices that you need to make for someone else in your family. And that's where our sponsor, Trinity Health Plans of Michigan, comes in and wants to help. Now, joining us today is Michael Wirth with Trinity Health Plan of Michigan to share a little Medicare 101. Good morning.
Good morning. Thank you for having me.
Thank you for being with us. So before we get into the specifics, why is it so important to talk about educating people instead of making decisions, just making decisions for them?
Ultimately, it comes down to comfortability at the end of the day. It's really tough for somebody to be confident in their decision, and especially when you start talking about something as complex as Medicare, really making sure that you have a background knowledge will really be able to help prepare you for what's to come, especially when it comes to the financial commitments, potentially.
Yeah, most definitely. So let's get into the lessons. First, who is eligible for Medicare?
So primarily, you're going to be talking about people who have attained the age of 65. That's going to be the bulk of people who are on Medicare. But there are also some people who are on Medicare because they have a chronic illness, or they have received Social Security disability payments for 24 months.
Okay, so it's good to know. This is a range of people who could qualify for this. Now, what are options available that people need to know about?
So there's a few paths that you can go by. There's original Medicare, and this is where you start hearing about the alphabet soup of Medicare. Parts A and B are going to be the original Medicare portion of it. However, with original Medicare, there's not prescription drug coverage. So you need to get prescription drugs from another source. Some people get benefits, whether it's through a union coverage or through VA. A lot of people, though, would have to then get a prescription drug card. So that is one option that people have to do. Another path that somebody might have to take is if they want to go for a Medicare supplement or a Medigap plan. So what those are going to do is it's going to help supplement or gap those bridges in the cost of original Medicare. Those also do not have prescription drugs, so you would still need that prescription drug card. The last thing is Part C. That is Medicare Advantage. If you decide to go down that route, it actually is a combination of Part A and B with some additional benefits not covered by Medicare, and many of those plans do have a prescription drug component built into them.
Okay, so you really need to look at your situation, really kind of figure out what it is that you need to figure out which plan is appropriate for you, right?
That is absolutely correct.
Right.
Every person is unique and individual in what their needs are, and there are many plans out there available, and each path, it really comes down to having the conversation with a professional to really make sure that you are going through and getting the right plan for you.
Yeah, absolutely. You don't want to miss an important detail because it can end up costing you a lot in the long run, right?
Absolutely, that's correct.
All right, so when can people enroll?
So generally speaking, there are a few different enrollment periods. So when someone is turning age 65, there is what's called a 7-month window. So it's the 3 months before their birth month, the month of, and 3 months after in which they can initially enroll into Medicare. There's a few other times as well, too. The one we had that was a major point was, you hear it all the time at the end of the year, October 15th through December 7th. That is the annual election period, or now called open enrollment period. So all those plans will start on January 1st of the following year. Some people might have some plan of the year changes as well, too, where there is a circumstance that happens throughout the year that will allow them a special enrollment to switch a plan.
Okay, good to know. So what are the steps that people need to take to get prepared for enrollment?
The best thing I could say is get educated on it. There is a ton of resources out there, and I highly recommend reaching out to a local professional. There are seminars that are being held. There are Medicare 101 events that are being held as well, too. So I would really look at those resources that are available. Of course, you can always reach out to one of the carriers, kind of like us at Trinity Health Plan of Michigan. You can call in. We have licensed agents who are happy to help and assist. You can also reach out to Medicare. So if you go to 1-800, you can call 1-800-Medicare or go to Medicare.gov. Those are all resources available. And lastly, there are individual professionals in your local community who can also help assist with that information.
All right, so get the help you need. I wouldn't attempt this without the help.
That's absolutely correct. I highly recommend you definitely want to talk with a professional. There is a lot of information to go over.
Yeah.
It's worth having that conversation with someone.
Might be a good idea. Well, Michael, thank you so much for being with us and sharing this really important information. We appreciate it.
Thank you very much.
And if you want to learn more about how Trinity Health Plan of Michigan can help you with your decisions when it comes to the right Medicare coverage, go to their website, thpmedicare.org/Michigan. Again, that's thpmedicare.org/Michigan.